Good morning, ma'am. I'm Rowena Doctor from BSN 22 and I'm going to perform ang parenteral administrations of drugs subcutaneous route and purposes. We have to allow slower absorption of medication compared with either intramuscular or intravenous route. And then we have the assessment, appearance of the skin injections, and specific drug action, expected response, client knowledge, and action of the response. We have to assemble all of our equipment. We have the vial or ampule, we have the filter syringe, we have the 3 ml syringe and the pen, and we have also micropore tape, and we have the cotton balls and antiseptic swabs, and according to agency protocol. And we have to check the mark for medication administration order, and we are assuming that this is our MAR record, and we have to check against the label of the ampule or vial carefully. We have to read the label of the medications when it taken the medications, before withdrawing the medication, and after withdrawing the medications. We have the implementation. We have to perform hand hygiene and prepare the medications from a vial or ampule for drugs withdrawal. By performing hand hygiene, we have to use alcohol to prevent any infection control procedure. And then we have to prepare our vial or ampule drug withdrawal. Here is our ampule or our vial. We have to open our syringe, and then we will use the filter paper to get the medication for our vial or ampule. Then we have to aspirate the where or how many ml we will get the amount of our medication. Presuming that our medication, or we are assuming that it will be 1.5 or 2.0 ml of our drug. We have to aspirate at the same level, and then we have to open our ampule, and then we will get the desired amount of the medication. Then we get the amount. You have to place the cover and move the needle upward. Then we have to change it. And we have to put the right needle. Then our medication is done. And then we have to check the client identity, and explain the procedure, and he or she will expect pain. Good morning, sir. I'm Rowena Doctor, and we will I will administering subcutaneous route, and you will experience a little bit of pain, and we have to select the site, the arms, where there is an adipose tissue. Here, then we have to clean the area with swabs or antiseptic swabs with a circular motion, and then allow it to dry. And then we have to place and hold the swab in the third, fourth fingers with the non-dominant hand. Have to put the swab, fourth fingers of non-dominant hand, and then we have to prepare our syringe for injections. Then we have to remove the cup. Then we have to inject the medication at a 45-degree angle. Grasp the syringe with your dominant hand, and in between your hand, facing upward. Use the non-dominant hand, pinch and spread the skin. And then we have pinch if less adipose tissue, spread if the client has more than 1/2 inch of adipose. And then we have to insert the needle and dominant hand at the end of the syringe and dominant hand to the end of the plunger. And then we have to inject the medication by holding the syringe and pressing the plunger with a slow and even pressure. And then we have to embed the needle within the skin for 5 seconds. And then we have to remove the needle and by pulling smoothly along and then insertion and depressing to the skin with a non-dominant hand. And if bleeding occurs, apply pressure to the site using sterile swab or sterile gauze. And then we have to dispose or remove our gloves. And perform hand hygiene. And document. We have to administration of medications, site, time, dosage, route, and nursing assessment. Observe for possible administration of medication or possible reaction to the administered medication and or effectiveness of medications at the time it is expected to act.